Hello, everybody. Good evening. Wonderful to be with you all here today, even though I know we can't see each other. I'm going to be talking today about one of my favorite topics, achieving hormone balance with bioidentical hormones. I like talking about this topic in October because this is Breast Cancer Awareness Month, and you'll see how pertinent this topic is as we delve a little bit deeper into the relationship of breast cancer with hormone imbalance in general in the body. So let me start by introducing myself. I'm Dr. Sushma Hirani. I'm the medical director of Rose Wellness Center in Oakton, Virginia. I did my training in family medicine, but eventually transferred over to integrative medicine or functional medicine. So I try to combine the best of both worlds. I use traditional medicine when absolutely necessary. My preference is to work with functional medicine, where we really try to look for the root cause, see what's going on in the body, and bring the body under better balance. Okay, so let's get started on our topic today. And please, you will be getting this presentation, a recording of this presentation. Please feel free to type any questions in the chat box as we go along. I will try to get to everybody's questions at the end. All right. So, in one of the first endocrine experiments recorded, Professor Berthold did an experiment in chickens at his local zoo. And what he did was he removed their testes. And what he found was those chickens became very docile. They didn't have that same aggressive male behavior that had gone away. And also their interest in the opposite sex, the hens, had gone away as well. And then what he found was there was a chemical substance in the testes, in that organ, and he injected that chemical substance back into the chickens and their behavior reversed. And that's how they discovered hormones. So what are hormones? They're chemical substances that act like messengers in the body. So they're usually made in a certain gland. For example, most estrogen is made in the ovaries. Some is made in the adrenals and other areas too. But if it's produced in the ovaries, then it travels through the bloodstream to deliver a message to whatever end organ it's going to, whether it be the brain, the heart, the bones, skin, etc. Okay, and then that message regulates body function and behavior. There's many different hormones in the body, and although each of them have their individual identity, they do work together in a synergistic way, just like different instruments in an orchestra. So even if one instrument is playing poorly, you're not going to have harmony in music, right? Everything's going to sound bad. So same way in our own body, we want to make sure that all our hormones are playing in tune. When the hormones are in balance, it results in good energy, a balanced mood, radiant skin, strong bones, healthy heart and mind. If the hormones are off balance or the instruments aren't playing right, this can oftentimes be the underlying cause of all kinds of chronic conditions, including chronic fatigue syndrome, fibromyalgia, heart disease, osteoporosis, etc. And if the hormones are off balance, we just simply don't feel good. So it's not like, it's a disease, but you kind of get a bunch of uncomfortable symptoms, right? So if you have all kinds of a variety, I just don't feel good, I can't sleep well, a lot of anxiety, irritability, gas, bloating, lots of cravings, I just don't feel good. You might be having a hormone imbalance. So again, as mentioned before, there are many hormones in the body. For the purposes of today's talk, I'm mostly going to focus on the two major female hormones, which are estrogen and progesterone. Women, of course, do have some testosterone, which is also important. Men have the opposite, right? Men have much more testosterone, very little estrogen and progesterone. And the blend of these hormones is what kind of determines a lot of gender differences between men and women. All right, so let's start by talking about estrogen, one of the major female hormones. You can see estrogen has many different roles in the body. It helps protect against heart disease, stroke, and high cholesterol. It actually decreases plaque buildup. So, young women that are not menopausal are very protected against heart disease most of the time. Estrogen also plays a huge role in brain receptor activity, mood, memory. It helps regulate body temperature, keeps the bones healthy. Of course, it helps with reproductive health and the menstrual cycle, preserves bone, skin elasticity, and healthy hair. Now, when we say the word estrogen, there's not just one estrogen. There's actually many different kinds of estrogen. So it's a little bit confusing if you were to just use the word estrogen. Know that to be more of a plural of all kinds of estrogens. So we have our own natural estrogens, which are made by the body. And we have 3 of those, E1, E2, and E3, as seen on the left side of the slide. Of those, estradiol, or E2, is the major estrogen, is the most potent, it's the most abundant. It's what creates or determines our menstrual cycle. And it's also what drops later on at menopause, causing symptoms. Then we have estrogens that are made outside of the body, a bunch of external estrogens. Of those, we have phytoestrogens, which are found in plants and certain foods like flax and soybeans. And then we have xenoestrogens, which are quote unquote bad estrogens, which come from a lot of environmental sources and chemicals, including in birth control pills. Okay, so all kinds of estrogen in the body. What's the difference between the good estrogen and the bad estrogen? Well, the good estrogen binds onto that receptor and delivers the message the way it's supposed to, right? So it's going to tell the bone cell, all right, bone, I want you to be healthy. And the bad estrogen, on the contrary, if that gets into the receptor, it sends an unintended signal, and many times the opposite. So it may break up bone rather than preserving bone. Okay, so what kind of estrogen you have in your body really does matter and really does make a difference in that. Are you going to feel the beneficial effects of estrogen or the negative? You know, there's a lot of confusion around there about estrogen, right? That's one of the reasons I enjoy this talk, because I really, want to kind of get that information out there. A lot of people are just so scared of estrogen. And then other women are like, I want the estrogen, I feel good with it, tell me more about it. So we're going to get more into all of this. All right, so what are some of the sources of xenoestrogens, or the bad estrogens? Well, unfortunately, they're all around us. If you just look all around you, there's probably an estrogen source sitting somewhere there. It's in our food, pesticides, insecticides, it's, non-organic dairy and meats, it's in our cosmetics, skincare products, processed soy, you see it in chemicals, you see it in plastics, they're just all over the place. And of course, if the more you're exposed to a lot of these things, the higher your bad estrogen level in your body may be. All right, so do you also eat these with that mask on? So if our body is working well, if our detox channels are working well, this shouldn't really be a big deal, because our body knows what to do. It says, all right, I got to make sure that I keep getting rid of all this unnecessary or unwanted estrogen. And if it's working well, everything's good. If you're overwhelmed with too much of that bad estrogen, or if your detox organs are not working quite as well, that's when estrogen can build up, okay? Unnecessary or bad estrogen can build up in the body. So there's basically 3 phases of estrogen elimination. There's phase 1, which kind of converts that estrogen into needed or unneeded. And then the bad or unneeded estrogen becomes deactivated in phase 2. And then in phase 3, that deactivated estrogen is all packaged up and ready to be eliminated out of the body. It is sent to the bile and then eliminated via our stool. So if you have gallbladder problems, if you have constipation, if you have the wrong type of gut bacteria and a lot of digestive issues, you're probably not eliminating that estrogen properly. And that's why poor gut health can also cause hormone imbalances. Okay, so there's a very strong connection there between healthy gut and healthy hormones. So I'm not going to go over all the details on the slide. You will be getting this presentation later, so please look through all of this, but I've given you some natural ways to help reduce or detoxify that estrogen better from your body. So, you can see the symptoms of low estrogen and high estrogen on the slide. You can see they're very different from each other. And it's important to note, again, I just want to reemphasize that estrogen, or estradiol, is actually not dangerous and very beneficial to the body. The only time it is dangerous is, 1, if your body is not getting rid of it properly, right? Or if you're exposed to too much of that bad estrogen. If estradiol itself was dangerous, well, then many women would be getting breast cancer in their 20s and 30s when we have the most estrogen in our bodies. All right, so progesterone is the other major female hormone. It is the yin to estrogen's yang. All right, both of these play a very important role in balancing each other out. Estrogen tends to be associated with more energy and movement. Progesterone tends to be associated with more calming and sedation. And of course, you want that balance, right? Because if you have too much estrogen or too little progesterone, you might be over energetic, where you have insomnia, anxiety, irritability, etc. Um, and vice versa. If you have too little estrogen or too much progesterone, you might be fatigued, tired, brain fog, can't think straight, right? So hence the balance. The energy has to balance with the calming property. You can see low progesterone symptoms. By the way, I want to mention that low estrogen symptoms are mostly seen in postmenopausal women. Sometimes you'll see it in younger women that are menstruating as well, but not as commonly. Low progesterone symptoms, on the other hand, are very commonly seen in both premenopausal as well as postmenopausal women. Okay, so irregular periods, infertility, miscarriages, headaches. The most common ones really are irritability, anxiety, and insomnia, can all be symptoms of too little progesterone. Then we have this term called estrogen dominance. What does this mean? Well, estrogen and progesterone, as I mentioned before, have a certain balance to each other. And if that balance is messed up, we can have symptoms accordingly. So estrogen itself kind of likes to build tissue, and progesterone, it kind of says, all right, stop, don't build so much tissue. So again, they work with each other to keep them in a balanced place. If we have too much estrogen, or if we have too little progesterone, or maybe we don't have too much estrogen, but we have too much of the bad xenoestrogens, any of those three patterns can create estrogen dominance. And it's important to know the pattern, because otherwise, how do you know how to treat it? Right? Because if you have high estrogen, well, you want to do detox or get rid of that extra estrogen. If you have low progesterone, you want to do things to raise your progesterone. If you have both, you want to do both of those things. And of course, if you have normal levels of estrogen, but just too much of the bad kind, we may want to look at the gut and chemicals and do other things to correct that, right? So how do you know? How do you know what your hormones are telling us? We can test. We don't have to guess this information. We can test and we can know exactly what's going on. So on this slide, I've given you an example of a saliva test on the top and a urinary hormone test at the bottom. Those are some of the better ways to measure hormone imbalance in women and men. So on the top slide, you can see there are very low progesterone levels, right? And you see very high estrone, the bad estrogen levels. So clearly that particular person has estrogen dominance. In the bottom slide, we see a urinary test kind of showing the same thing. Too much of the total estrogens you see in the red there, and too little of the progesterone, again, creating that estrogen dominance. What are some of the symptoms of estrogen dominance? They're written on the slide. Keep in mind, again, too much estrogen or too little progesterone can both cause these symptoms. So how do you get too much estrogen or too much of the wrong kind of estrogen? Again, we've talked about that, environmental, but also diet, stress, birth control pills, okay? Gut issues, liver issues. How do you get low progesterone? One of the most common causes for low progesterone is actually stress. When we are stressed, we make a lot more of the hormone cortisol. And and you can see on the slide, progesterone is a direct precursor to cortisol. So the more cortisol or stress hormone we produce, the more progesterone sacrifices itself to turn into cortisol. And as a result, we have too little progesterone for the amount of estrogen, leading to estrogen dominance. Okay, so when there is too little progesterone, you have to evaluate cortisol and make sure stress is not contributing to this. Just one slide on testosterone. Again, also an important hormone, and we can just do another presentation on the dynamics of testosterone in the body. But I just wanted to put this in here to let you know, also important. When I am hormone balancing, I usually try to balance estrogen, progesterone first. And if we still need balancing with testosterone, then we take care of that too. Testosterone doesn't only play a role in libido and sexual activity, but it also plays a role in our musculoskeletal health, metabolism, brain health, cardiovascular health. So also definitely an important hormone. And this is both for men and women. All right, let's talk a little bit about menopause. So, menopause is that important time period in a woman's life, right? Every woman has either gone through menopause or will go through menopause. Very important time frame, and probably a time frame during which a lot of women are confused, feeling miserable, and don't really know what to do. It's just a lot of confusion out there. Do I have to live the rest of my life in this misery, or can something happen? Can I do something to make myself feel better? Do I have any control over this? Right? Becomes a common question. You can see on the slide, there are so many symptoms of menopause. I've heard so many different things: electric shock sensation, itchy, crawly skin, but the most common are the ones in the orange. And perhaps the most disruptive of all of this is insomnia, hot flashes, and night sweats. If I want a rapid heartbeat and to get all hot, I only need to wait for my menopause symptoms. Now, it's important to note, just before we actually hit menopause, we undergo a transition period called perimenopause. And during that transition period, your progesterone actually drops much quicker and by much more than estrogen. Progesterone drops by 75%, estrogen drops on an average by 35%. So before you actually hit menopause, the more common hormone pattern is estrogen dominance. So again, very important to check, because you can't just assume that I've got low estrogen, I'm going to replace with estrogen and feel better. You may feel worse if you've got estrogen dominance. So the average age of menopause is 48 to 52. Definition is 1 year of no menstrual bleeding. Women these days are spending more than a third of their lives in menopause. So of course it's important to be healthy and feel good during this time. Okay, 60 to 80% of women experience hot flashes and night sweats during and after transition. If you've had a hysterectomy, even if your ovaries had been left in, by the way, there's a tendency to have more frequent severe hot flashes. In the past, they said, well, hot flashes is going to last about a year or two and then you'll be fine. But now we know different. In fact, the median duration of hot flashes have been found to be 7 to 10 years. And 10 to 15% of women have persistent hot flashes throughout their life. You can see on the slide, 60% of women actually have moderate or severe hot flashes 1 year prior to menopause and up to 2 years following their last menstrual period. So this is a significant issue. And unfortunately, many women are not getting treated for this because they're too scared. They don't know what to do. Okay. And what we'll talk about, shortly over here is there really there really isn't that much to fear. Okay. And we'll get into that in detail. So of course, hot flashes can affect your quality of life, as can other symptoms of menopause as well, right? If you have insomnia, mood disorders, etc. Now, I want to point out over here that a hot flash is not just a hot flash. Okay, it's not like, okay, I'll just have a hot flash, I'm dealing with it. It actually is associated with worse long-term health consequences. So if you have severe or significant hot flashes, you're actually having more brain damage going on. You're actually having an increased risk of heart disease, high blood pressure, high cholesterol, blood sugar issues. You're actually having increased inflammation, low bone density, and a higher risk of fractures. Okay, so hot flash does need to be taken seriously. It's not just a symptom. Here's a picture on how the hormones affect brain health. You can see the red indicates area of maximum metabolic activity. So that's good. Red is good. The yellow-green is lower activity, and then the blue is very little to almost no activity. So look at the difference there. In premenopause, which is a menstruating woman, look at how much red there is in there. And then you see at the transition time, much less red. Wow, it's suddenly just, a lot of it has disappeared. A lot more green, the green, yellow, and more blue, of course. And then in postmenopause, very little red, a lot more of the blue. So women's brains seem to age faster than men's during that menopausal transition. And most likely this is related to estrogen loss. Okay. So it's not that menopause causes Alzheimer's disease, but if you have a risk for Alzheimer's disease, menopause will probably accelerate the process. And there is some evidence that replacing estrogen within 5 years of menopause may really protect against that Alzheimer's as well as other forms of dementia. You can see on this slide, and not only does menopause affect brain health, but it also leads to accelerated plaque formation. Remember, we said before, protects against plaque. So when your estrogen levels drop, there's no longer that protection. And so at menopause, a woman is at the equal risk or higher risk compared to men of developing heart disease, versus before that, when there's a much, much lower risk compared to men. I'm a victim of identity theft. Menopause took a happy, slim, sexy woman and turned her into me, right? How many of us feel like that? And I hear that a lot, women that come with hormone imbalances, whether it be perimenopausal or postmenopausal. I just don't feel like myself anymore. I feel like something has changed. I just, something's different. And so if you're feeling those kinds of symptoms, it probably is a hormonal imbalance. So how do we treat hormone imbalances? Well, you look for the underlying cause and treat that. So important. So environmental toxins, gut health, liver detox, the right type of diet and exercise. Make sure you're managing sleep and stress properly. Herbs, there's, those phytoestrogens and other herbs which can help with hormone symptoms. And then finally, bioidentical hormone replacement therapy. These next few slides go over sleep and stress, and I'm going to kind of skip over them, not because I don't think it's important. In fact, they're critically important. And I'd actually do a whole nother talk just all on stress alone. So very, very important. When you do get these, please do look over these slides. But in the interest of time and just passing along more information, I'm going to skip over to and talk about hormone replacement therapy. So what does this mean? This is when you replace or take external hormones because the ones in your own body are too low or out of balance. So yeah, again, there's all that scary information out there. Oh, it increases breast cancer risk, heart disease risk. Well, guess what? The tide has turned. Experts both in the field of gynecology and outside are actually suggesting we should probably start everybody on hormones 5 years or so after menopause, which can be beneficial for your health. There are still people and doctors out there which say estrogen is dangerous and won't prescribe it. But the reality is that's not the approach of menopause experts, and that is no longer supported by science. And I'm going to go over that for most of the next few slides. Before we actually go over that, let's talk a little bit about how hormone replacement therapy works. So this is a bone cell. You can see in the first, on the left over there, you see a healthy bone cell. You have healthy hormone levels, and all the minerals kind of stay in the cell the way they're supposed to. In the second square over there, rectangle, they're low hormone levels. Okay, so maybe menopausal or low hormone levels, not enough hormones, so the minerals are all leaking out of the bone cell. And in the third slide, hormones are injected. They go and they bind on or lock on to the receptors, and now the minerals start to go back in again. All right, so that's kind of how hormone therapy works. So in the past, in fact, just not too long ago, hormone replacement therapy was recommended for all postmenopausal women. They said, oh, you're turning postmenopausal, let's start you on hormones. Why? Because it's so good. It reduces your risk for any kind of medical complications. All right. And mostly what was being used were synthetic hormones known as Premarin and Prempro. Then in 2002, everything changed. A very large trial was done called the Women's Health Initiative, which showed that these hormones are very dangerous. And all of a sudden, women everywhere were taken off of their hormones. They were scrambling for other ways to try to get relief. All these women that were feeling better kind of now felt miserable, and there was just a lot of chaos. So what was this Women's Health Initiative study? Well, in this large study, they basically divided women into two groups. To one group, they gave synthetic estrogen only. And in the next group, they gave them both synthetic estrogen and synthetic progesterone as a combination. I'm going to call it progestogen because it really is very different from bioidentical progesterone. Well, it was supposed to be an 8-year trial, but they actually had to stop this trial in 5 years because there was a significantly increased risk of breast cancer, strokes, heart attacks, blood clots, right? And that changed the whole general view. And even till now, many people are scared of estrogen. To make matters worse, the media kind of created even a further widespread panic, right? Which kind of, again, still goes on. But was it really a good study? How good was that study? On further analysis of the data and controversies, we actually find that that wasn't a good study. When the data was re-examined, what they found was that nearly 70% of the women in the study were over the age of 60 when they started their hormone replacement treatment. Well, guess what? The average age of menopause is 51. So if you're starting hormones at 60, that's a whole 10 years, after. And somebody that's at 51 compared to 66, there's going to be a very different risk profile. And also at 66, you're not really having that many symptoms. Most of the symptoms are at 51. Okay. And most of these women that were in the study, because they were over 60, guess what? They already had, heart disease, high blood pressure, diabetes, cholesterol. So how do we know it was the hormones versus, their own kind of natural risk for developing these conditions? And only 12% of them, by the way, had moderate to severe hot flashes. So not really a good population that they did that study on. Now, when you look at the results of the study, look at this. I mean, this is pretty astounding. You can see in the group that they gave only the synthetic estrogen to, when we look at the first category, age group, 50 to 59 years old, what do you see? You see that actually the heart disease and breast cancer risk went down. In fact, it went way down. They reduced their risk of breast cancer and heart disease, not increased it. Okay. The 60 to 69-year-old age group, even in that age group, actually, breast cancer and heart disease risk went down, but stroke risk and clotting went way up. And then in the 70 to 79-year-old age group, all of that, of course, was much higher. And a large part of that is because of age. Okay. Here we see in the second group of women that were given the synthetic estrogen and synthetic progesterone, we see a little bit of a different profile. Here, across all age groups, there were increased risk, but lower in the 50 to 59 age group and much higher in the 70 to 79-year-old age group. So what does that tell us? It wasn't actually synthetic estrogen that was the problem. It was synthetic progestogen that was the problem. Okay, so here's all this estrogen fear when synthetic progestogen is actually what should be feared. So in both groups all across the board, you can see there's a lot more risk reduction, okay? But of course, much, much better in the estrogen only group compared to the estrogen progesterone combination group. In that group, breast cancer risk did go up. So what was the conclusion? Well, hormone replacement therapy reduced the risk of all causes of death by 31%. The majority of evidence showed a reduced risk of heart disease using synthetic estrogen alone. In fact, even aspirin and cholesterol medications like statin don't have that much of a benefit as the hormone replacement therapy did. And again, to re-emphasize there, it was a synthetic progestogen that would actually cause the increased risk. But, how much of an increased risk? Let's put that into perspective as well. Okay. How much increased risk did the synthetic progestogen cause? Well, when they looked at the data, basically one extra person will get breast cancer per every 1,000 patient that was on the estrogen progesterone combination. That's less risk than somebody that drinks 2 glasses of wine a day. And it's a similar or lower risk for somebody that's obese, sedentary lifestyle, or many other commonly used medications. Okay, so not really that bad. And in fact, they've done many, many studies since then, and they found that bioidentical progesterone is much, much safer than the synthetic progestogen, very different risk profile. In fact, if you don't really have a risk of blood clots, your chance of getting a blood clot, even with the synthetic hormones, is low. That being said, they've done lots of studies on transdermal bioidentical estrogen since then, as well as, like I said, the bioidentical progesterone, and found that the risk of developing a blood clot is extremely much, much lower with those. Estrogen, oral estrogen kind of goes through the gut and through the liver, and it makes the blood more sticky. But if it's in a cream form or a patch form where it's kind of absorbing topically through the skin, you don't really seem to have that same risk. And if you're using a low dose vaginal estrogen, there's no risk of increased blood clots. Okay, so the one thing that the trials did show somewhat of an increased risk was the blood clots, but if you use the bioidentical hormones, you reduce that risk significantly also. Here's a slide that shows you some differences between the progesterone and synthetic progestogens, right? The one is actually good for your heart health. The other one causes high blood pressure. One is good for hair growth. The other one causes hair loss. One of them is very good for mood and sleep. The other one causes anxiety and depression. So, and one reduces the risk of breast cancer, which is the natural progesterone, versus progestogens, which increase the risk of breast cancer. So these are very different compounds. So in 2015, they kind of looked at all the different trials that have been done through time. They looked at 19 different studies, over 40,000 postmenopausal women who were started on who were started on hormone replacement therapy within 10 years of menopause. And what they found in conclusion was that in those women, they had a reduced risk of heart disease by 48% and a reduced risk of death of any cause, due to any cause, by 30%. So in conclusion, hormone therapy has benefit for heart disease prevention in the right patient. So who is the right patient? Well, timing is key. Okay, estrogen therapy is very unlikely to be effective in a woman that's 60 years or older who no longer has menopausal symptoms. And in fact, the longer you wait to start on hormones, the more likely that you'll already get into a lot of these other health problems, right? Clogging of the arteries, belly fat, etc. So who's the right patient? Well, if you're under 60, if you've been less than 10 years or less out from your last menstrual period, and as long as you don't have any other major risk factors for breast cancer or clotting, you're a good candidate for hormone replacement therapy. And more than likely, you're going to be preventing a lot of conditions. In somebody that's over 60, not such a good idea. Okay, well, you could use it in over 60 with caution. But if you're more than 10 years out from menopause, then definitely not a good idea. In fact, the American Heart Association made a scientific statement as early as 2020, where they actually endorsed the use of hormone replacement therapy in the right patient population. Okay, that's the key. They said that the benefits of hormone replacement therapy, including lower rates of diabetes and protection of bone loss, appear to outweigh the risk for the majority of early menopausal women. So they actually recommend its use as a treatment for heart disease. So what is the difference between synthetic and bioidentical hormones? The main difference is, how they're made. So synthetic estrogen, for example, Premarin, comes from the urine of pregnant horses. And there's other chemical products that are involved in the progestogens as well. So maybe natural to horses, but certainly not to humans. Bioidentical hormones come from plant sources, usually yam or soy, and they're chemically identical to the hormones that our own body naturally produces. They're usually compounded in labs or pharmacies. They can be individualized or custom made. And as we already pointed out earlier, much safer and fewer side effects. When we use bioidentical hormones, we of course want to test first, right? We want to see what things look like. Don't just assume because you're menopausal that your estrogen is low. No, you might be having estrogen dominance. We may have to raise your progesterone and reduce your estrogen, and we may have to work on the gut and the liver, right, and do other things. So very individualized approach. Everybody has their own biochemical individuality. Let's look at that orchestra. Let's look at all the instruments in the orchestra. Let's test, not guess. And once we know what's going on, then we can begin our little, hormone balancing dance, as I call it, or regimen. Simple concept, replace what's too low and get rid of what's too high, right? Bioidentical hormones come in many different forms. Most commonly used forms of estrogen are cream and patches. I personally really like the patch. Lately, I've been using the patch more commonly with patients because it's a nice, even delivery, but creams can work as well. I try to avoid oral estrogen because remember, that can make your blood more sticky and increase risk of clotting. And of course, with progesterone, either the cream form of progesterone or the oral form of progesterone are both fine. Really just depends on the individual. Okay. Once you start the hormones, very important to follow up regularly. You want to do regular hormone panels either every 6 months or every year, depending on how stable you are. Make sure, everything is well balanced. Get rid of any bad estrogens that might be in there. And as long as you keep doing this on a regular basis, hormone replacement therapy can really be very effective and very safe. Now, it's also important to understand that that hormone replacement therapy doesn't mean that we're giving you all the same amount of hormones you were making when you were 20. Okay. It's not replacing that same hormone level. We're just giving you a little bit of hormone, a very small amount, to improve your symptoms and work on that preventive health. Okay. And actually, the amount that you're taking through these bioidentical hormones for replacement therapy is a much lower amount than hormones that you're getting from the environment as well as from birth control pills. Birth control, what are birth control pills? They're essentially synthetic estrogen and progesterone. So all of those risks that we talked about, that applies to that as well. So again, start low, go slow, eventually increase your dosage. We work together to personalize treatment, get you feeling better. So HRT or not, right? Ultimately your choice. So one of the big goals or purposes of this presentation that I wanted to get across is, one, hormone replacement therapy is not scary and it's not bad. That's very much been blown out of proportion, and all the data was used, in the wrong way. And even when a lot of that analysis started, it didn't make it into the news quite as much as, unfortunately, it did. And when it showed the opposite things, right? So all the bad stuff was really highlighted, but all this good stuff is just not being highlighted enough. But the other goal that I wanted to get across is the right candidate, right? So not everybody is a good candidate for hormone replacement therapy. You got to be the right candidate. So if you are within 10 years of menopause with symptoms, especially severe hot flashes, okay, moderate or severe hot flashes, or if you are under 60 without any other major risk factors for breast cancer or clotting, you are probably a good candidate, all right? And you're probably going to be reduced, not probably, you will be. There's been enough studies that have now proven this, that you will be reducing your risk and inducing preventive health, right? For heart disease, breast cancer, and some of the other different things we talked about. So again, understand if this is for you or not, and it's not for everybody. And if it is for you, hopefully this has dispelled some of your fears. And also understand that, you do want, if you are having a lot of those symptoms even before menopause hits, you want to look for those bad estrogens and get rid of those, right? Because too much bad estrogen in your body can also increase your risk for breast cancer or clotting. It acts just like those synthetic estrogens. So, and the balance of estrogen and progesterone are very, very important, right? So HRT or not, ultimately it's your choice, and hopefully now you can make a little bit more of an informed choice. So thank you. You've all been a wonderful, wonderful audience. I really do enjoy giving this talk just because, like I said, there's just, so much new information out there. And, I've actually changed this talk over time in these last couple of years because more and more new information just keeps coming out. So stop the struggle, transform your body, and recapture your health and happiness. Again, I'm Dr. Sushma Hirani, Medical Director at Rose Wellness Center. We focus on functional medicine, really trying to get to the root cause, understanding what's going on in the body, and helping with better body balance. Thank you so much for being a wonderful audience, and you will be getting this presentation shortly. Feel free to reach out to us or contact us with any kind of questions, or if you need to contact us for anything else, our information is on this slide. Thank you again, and have a wonderful evening.